It's a new warning from the Surgeon General about alcohol. He says alcohol is among the leading preventable causes of cancer and believes alcoholic beverages should carry a much stronger warning label. Joining us now is Dr. Darin Detwiler, a professor of food policy and safety at Northeastern. Doctor, first of all, thank you so much for joining us. Let's go ahead and set the table for what these warning labels might look like and what other types of products they're already on.
Well, first, you can't even go to a hardware store today without buying a screwdriver or a wrench that doesn't have a label on it or a sheet or two of instructions in terms of the potential dangers, wear proper eyewear, adult supervision, things of that nature. And there are existing warning labels on our food and drinks, specifically around expectant mothers and safe, responsible consumption in terms of no drinking and driving. Introducing cancer warnings on alcohol labels would represent a significant shift in public health policy, acknowledging a growing body of scientific evidence linking alcohol consumption to various cancers, including breast, liver, and colorectal cancer. And I think that these would align with the alcohol labeling needs in terms of similar efforts with the tobacco industry and even food safety, where there is labels that we've had for over 3 decades that say that proper handling is required in terms of making sure that this product is safe for you because there is a potential of risk. So for consumers, it means greater transparency and the opportunity to make more informed decisions about their health. We're talking about addressing preventable causes of cancer. We're talking about reducing long-term healthcare costs and potentially saving lives.
You hit on a key point there, Doc. For decades, it's been said that moderate drinking was okay for most folks, but that ideology is changing. Alcohol labels have warnings about drinking while pregnant and driving under the influence. So what would it mean to have these labels upgraded with that cancer warning?
Well, this is nothing new. For decades, it was said to be a healthy thing to do to smoke cigarettes, right? But these labels now can be a powerful tool for promoting public health when it comes to these challenges and raising significant awareness in terms of these issues. No one wants to have cancer. No one wants to have prolonged medical implications and health bills, healthcare costs, and obviously, we want to keep families intact. So empowering individuals to make informed decisions and encouraging safer drinking habits is a far cry from preventing alcohol. So we're not saying that the Surgeon General or the federal government in general is banning alcohol. All they're saying is there's information that really needs to be in the hands of consumers so they can have that kind of transparency and awareness and perhaps have that nudge to make a more informed decision.
You and I were talking before this interview, and we hit on this point that you believe this is sort of a double-edged sword when it comes to labels. Why so?
Well, we saw this earlier with other warnings that the federal government puts out there. There's going to be conversations around what exactly is the information that should be put out. Do you put out too much? Do you put out too little? If you put out too little, it becomes a pointless message. If you don't include the why behind it, then people are just going to ignore it. And if it's too if it's too broad of a message, there could actually be a bit of a fatigue such that consumers will start to, ignore it. They'll stop paying attention to it. But what we want to kind of acknowledge is the fact that there's potential downsides. We're going to see voices from within the alcohol industry talking about a threat to sales, deterring people's consumption about this. Hey, let's be honest. You can't really separate from any kind of a music event or a festival or even a sporting event the amount of alcohol that's sold there. Heck, you can't even go to the airport without seeing how much alcohol is sold at an airport. The fear over deterring consumption. We're going to see lobbying efforts by the alcohol industry to oppose any such labeling, citing potential economic losses. They'll cite job losses, and they'll cite the risk of unfairly stigmatizing their products. But the reality is the same exact warnings were spread or lobbied by the tobacco industry and the meat industry. And decades later, guess what? There's still a lot of tobacco industry. People are still smoking. There's still a meat industry. People still eat meat. But all these consumers are more informed and have the ability to make that educated decision. So, there's the fear over the idea of, is it punitive or fear-driven rather than informative? What are these actual labels going to send as a message?
And you raised the point that there are labels on lots of things nowadays. Are you going to get deaf ear syndrome from a lot of folks in the public who have, drinking is a regular part of their weekly or daily lives, and they're just going to go?
Well, it's very possible. And look, we can't legislate that people read these things. We can't legislate that people understand these things. But there's a point where we say, look, there's a responsibility that our government has in terms of public health. And if we know this information and we can provide information about a clear, scientifically proven connection between alcohol consumption and these potential deadly cancers, then we have to take that public health step and put that information out there for consumers to do whatever they want with, rather than risk the idea that, people might be mad at the government. Well, guess what? There are going to be people who have these cancers who at some point are going to be mad at the government because they were never informed that there's a potential risk that they're taking by having, too many drinks, whether it's daily, weekly, or throughout their lifetime. So again, back to that double-edged sword kind of a thing. Yeah, if you're damned if you do, you're damned if you don't. I think we want to look at the responsibility then we should always do it, not worried about the idea of, any kind of benefits from if we don't do this. I think it's one of those things where the cost of doing nothing is greater than the cost of doing something in this case.
And with that in mind, what are the chances there will be real change on these labels, even with this latest warning and the research that is pointing to a cancer risk for alcohol consumption? What are the chances you think these labels, warning labels, will actually get on alcohol?
Well, I believe that supporters would talk about the idea of the benefits of prioritizing public health over industry pressure, and that increased public awareness will actually drive demand for change. Again, there's been historical pushback, but other countries are adopting similar labels, and surveys and tests in other countries have shown that people looking at these similar labels have actually been able to understand and be more mindful, or more able to remember that it's not just pregnant women, it's not just those who are getting behind a wheel, it's everyone who is consuming these that has a potential increased risk with more drinks that they consume. So, when we look at the idea of adding momentum to a growing conversation about alcohol, and obviously our very growing conversation about health and about healthcare costs, I do think there's a very chance for some real change around this. And, there's going to be efforts to measure this, and it's going to be impossible to measure how many lives were saved because of this. We saw this 3 decades ago with the safe handling instructions that were put on raw packages of meat and poultry. The idea of safer handling could mean that you're safer in terms of not getting sick from a foodborne pathogen. We can't count the lives that we can save, but when we look at just how many deaths we have year after year after year due to these preventable cancers, we have to say, at what point do we have the ability to justify doing nothing? We have to be able to say there's a good reason why putting this information out, allowing consumers to have a more informed decision, and to have this ability of transparency within this sector of the food and drink industry is the right thing to do.
Dr. Darin Detwiler of Northeastern University, excellent information. Thanks so much for joining us.
Thank you very much.